Next speaker we have Dr. Gandhi, Gandhi ji. There is always a picture on the Sammelans. I see him all the time, and his topic is science of mindfulness and emotional regulation in the Vedas. Dr. Gandhi.
Namaste everybody.
Namaste.
This topic, mindfulness and emotional regulation, has become a very popular topic in America because people have a very stressful life and they have hard work and they realize that they can't find happiness in life. So they turn to our Eastern traditions how to develop mindfulness. Then they find out that if you don't have emotional intelligence, you cannot succeed in life because people come out having a very high IQ in school. And then when they went to work, they find out that high IQ does not guarantee success in life. When they studied about 500 corporations, they find out that success depended on the presence of emotional intelligence, not intelligent quotient. No doubt you need intelligent quotient, that means that you have an IQ of 110 or 120, you can perform the job. But if you don't have emotional intelligence, you cannot progress and you cannot manage people. So this has become a very important thing. It has started in many industries. They find out that why people don't succeed, why people don't know how to deal with people, why the children are fighting more in schools, why people are using drugs, why they're unhappy. All those things are finding out that you need to understand emotions. Next slide. So in this slide, maybe, I don't know, maybe a little smaller, this science is known to us for a long time. In Gita, in the chapter 2, verse 15, Lord Krishna says that the person who is calm and remains unperturbed by either pain or pleasure is the one who attains immortality. So this is actually a description of emotional intelligence. See how to be calm while you are during pain or pleasure. So emotional intelligence teaching is, based partly on that. I will show you the scientific effect, how we teach emotional intelligence here. Then in Upanishads, there's a description saying that even as fire finds peace in its resting place without fuel, when the thoughts become silent, the soul finds peace in its own source. Because our mind is always disturbed by different thoughts. And when the mind is silent, then it can enter into a world which is far beyond the mind, the highest end. The mind should be kept in the heart as long as it does not reach the highest end. This is the wisdom, and this is the liberation. So next slide. Here, this is the description of mindfulness. This is not much different than what you read in Upanishad or what Lord Krishna said in Gita. This is the description of mindfulness used in this country. This is described by a gentleman called Dr. John Kabat-Zinn, who was a molecular biologist, had a PhD from Harvard, and he was not happy with his life. So he suddenly devoted his life since 1979 to teaching people how to practice mindfulness. So he described mindfulness being paying attention in a particular way. This would mean that you are here. You tell your mind to be here. Because your body is here, but your mind is somewhere else. You're thinking that I have to do this thing, I have to make a phone call. Oh, I forgot to return this phone call. I have to, I was not happy with what I ate. I should do this. Our mind is lost. Either we are rehearsing what we're going to do, or we are rehashing what happened in the past. So we always living in the past or the future, so we forgot how to live at the present moment. And happiness can come only if you're living in the present moment. You cannot say that I'm happy yesterday, I'll be happy tomorrow, if you're not happy now. So this mindfulness teaching is very important to live at this moment. And by living in this moment, you can handle many things. And it says in a particular way on purpose that you do have to make, you have to make, you have to work to get into that. You tell your mind that at this time I'm focusing on this present moment and non-judgment. This is in a way we're talking about meditation, When you handle things in life, you don't want to be judgmental. Suppose you sit down and practice mindfulness, formal practice of mindfulness meditation. Then you tell yourself, I could never sit still because my mind is always somewhere. If you start blaming yourself or blaming others, then disturb your mind, then you cannot focus it. They say that mind can focus only at one thing at a time. Either you give attention to what you're going to do, or you think about it. You cannot do both things together. If you want to really succeed in life, you have to pay attention to what you're doing. So there was a study from Harvard Business School. They said that the leaders who are present at work, they will succeed. That means that there's a leader, but his mind is somewhere else. He's not putting all the effort into work. How can he succeed? So that's why mindfulness is very important to succeed in life, to be able to handle stressful situations. Next slide. So this is the meditation that I teach in a hospital setting. Okay, I teach to the nurses, doctors. In the last year I did about 40 sessions in the hospital. Everybody has very high stress. So meditation is very important to reduce the stress. Okay? So what meditation does is that it's mindfulness meditation. That means that you're able to focus. When you do yoga meditation, that's also mindfulness. When you do the mantra meditation like TM, that's also mindfulness. And what this method has done is that it takes away the religion out of it, and then just teach scientifically, say that, you sit down, you have the intention that you want to reduce stress and you want to increase well-being. Then you focus on your breath. Focusing on breath means that you are observing, you are feeling the breath. You feel the breath in your nose or you feel the breath in your stomach, and then you suddenly notice that your mind is distracted. You're thinking, if you look at your mind in a matter of minutes, your mind may be in 100 different places, If you start looking, and you're trying to focus on your breath and your mind is somewhere else, you come back. So that's why there is nothing like a bad meditation. Because you keep on practicing, and then your attention, ability to give attention to the particular thing will increase. I use this in treating children. I tell them that in the emergency room, I'm a children's surgeon, so I tell them that if you focus on your breath, I teach them how to focus on the breath. Then when I do a minor surgery, they won't feel it, because when they are just focusing on the breath, they are not thinking that they're going to have pain, because pain has got two components. Either pain has got sensory component, and second component is suffering component. In the brain, there's a center where it feels the sensation, another center where it thinks about it and causes suffering. So as soon as you start thinking about the pain, your suffering goes 100% more. So whenever you sit down to practice meditation and you get distracted, ruminating, worrying, fantasizing, you tell yourself, now, don't be critical. Don't blame yourself. Oh, I can't sit still. I can't really think. And then you treat yourself with kindness and curiousness. Can I get a little silence here in the front? Yeah, because if I'm paying attention to you, then I cannot pay attention to everybody else, because my mind can only function at one time. That's why you know that when people are, teenagers are driving in the car and they're taxing, they get into accident, very high accident rate. So the science is finding that multitasking is a myth. Multitasking doesn't work. A lot of people who work in the hospital tell me, my department wants me to multitask. But the science shows that if you multitask, you're not doing anything right. Because you're not paying attention to one thing. How can you do two things at a time? You barely can do one thing at a time. So that's why mindfulness teaches that pay attention to this particular thing, what you're doing. So that's why I want to pay attention to what I'm talking to you. Otherwise, I'll be just talking, listening to his discussion. So instead of being self-critical, you must be kindness and curious. That means that you don't want to be self-critical yourself. You don't want to blame yourself. You need self-compassion. If you want to give compassion to others, you start from yourself. And next slide. So this practice of mindfulness can be trained. You know that somebody say that, oh, I can never sit still. I was giving talk to some of the nurses and doctors say, oh, my mind is never still. It's all everywhere. I cannot sit still. So what you do, science shows that you can train the mind. See, like you lift the weight, you train the muscle. Suppose you are not really able to lift this big weight, but you still having an exercise done, your muscles getting stronger. Same thing, when you practice mindfulness meditation, your mind wanders away, you bring it back. So that's the exercise. If it goes away 100 times, you bring back 100 times. There's nothing like a bad meditation. So the attention is so important that, William James, who's considered to be the father of psychology in the Western world, 1890s, he described, to succeed in school or to succeed in life, you have to be able to possess your mind in clear and vivid form. Unless you're able to be in charge of your mind, you cannot succeed in life. You cannot study well if your mind is wandering somewhere. So it's important to a student and important to people who are work. In every facet of life, mindfulness is an important thing. Then one of the other things you want to practice is that it's called a meta-attention. That means that you notice when your attention wandered away, you bring it back. That's the most important. That's how you practice the mindfulness. Next slide. So when do you use this? See, applications. When the situation comes, you pause, notice your thoughts and emotions, And then you change from yourself from a doing mode to a being mode. What is doing mode to being mode? Doing mode means that your mind is doing something all the time. It's thinking, it's planning, it's rehearsing, rehashing. From that, you try to be in the being mode. Being mode means that you are just there. Your mind is present where your body is. Instead of your mind controlling what you're going to do, you are telling the mind, this is what I want you to do. And mindfulness in daily activities. That means everything you do with mind. People say that, I'm in the shower, but I'm not really myself. Somebody else in the shower because my thoughts is thinking something else. You're having a breakfast and you don't know what you eat. You ask people what they have for breakfast, they don't remember. Because they are eating so quickly that they're not paying attention to what they're eating. So that's why one of the treatment of mindfulness is very successful in mindful eating. There are programs, and I had one of my staff had a problem with eating problem, and because of eating problem, there were multiple health issues. But she was very good in other things. So I asked my associate, I said, I can't fire this person. She's very good what she does, but she's always sick from something else. So I said, would you mind if I create a program for mindful eating? So I created it with one of the nutritionists. We created a 4-week mindfulness program for eating. Mindfulness program eating is that you know what to eat. Look at the food. How much do I need? What is this food? Is this food good for me? Am I eating the right food? You just stop and look at your food and know what you're eating. So mindful eating is a very effective way. And the same thing when you're driving. You're mindful driving. You pay attention driving. If you're not paying attention, you can be accident. So to practice that, you need sitting meditation practice. because to be mindfulness the rest of the life, you have to do practice. That's where your sitting meditation comes in. So what are the benefits? You are able to sort out what kind of things happening around you. You recover from distraction, improve your cognitive capabilities. That means the decision making. Because when your mind is clear, you're going to make the right decision. If your mind is not clear, the decision is not going to be good. Then it will help you to handle the emotions. Because we have emotions, you get upset, you are sad, you feel that somebody cheated you. All those emotions are happening. If you practice mindfulness, you can sort out these emotions. What are real emotions, what are important, what are not. Next slide. See, the science show that when you look at, there was a group of tech workers, very high-tech workers in Wisconsin. They had a waiting group. They were going to attend an 8-week meditation course. So these people had a injection for the flu vaccine, okay? And their antibody levels were drawn how this flu vaccine worked. And then they compared with a group of people who took 8-week course of meditation with a group of people who didn't have experienced meditation. They find out that people who meditated, they have a much higher level of antibodies to flu vaccine. And this was duplicated. And it's studied in other diseases like psoriasis. When you pay attention and when you meditate, people with autoimmune disease called psoriasis, they heal 400% faster. Next slide. So this is, what Patanjali said, when an event occurs in the mind, it's triggered either by the sensory, perceptual input or by thought, memory or arising of another emotion, we create negative, positive emotion. See, first we talk about mindfulness. Now I'm going to talk a little bit about emotion, how we relate to emotion. Because of emotion, you have sadness, anger, contempt, many things, emotion happening. So Patanjali has long recognized that, from your thought, from memory, from the previous other emotion, we have this negative. They call it aversion or attachment. Okay? You get this emotion whether you really, I have this, I really like it, and you attach to something. And then you hear something that you just can't take it. So that's aversion. And this is science also shows the same thing now. What Patanjali taught now, when I talk to the Western audience, I have the scientific showing that this is what attachment and aversion causes emotions. Next slide. See, the valence is an intrinsic attraction or aversion that Patanjali described as raga and dvesha, which is desire and aversion. Two of the kleshas or obstruction to the peace of mind. It is the valence, the raga and dvesha, that initiates an unfolding or cascading of mental events. See, I'm talking from the science point of view. Science says that emotion is this cascading in the scientific sense that creates the meaning. So that Patanjali said that. So now I want the next slide, I want to describe to you what is this emotional intelligence. Very interesting thing. This emotional intelligence description came out only in 1990. People are wondering, why some people succeed and other people don't succeed. They have all the abilities, but they were not succeeding. So there was a situation. U.S. Embassy had a diplomat in Africa, and one day there was some demonstration against the diplomat. So then he informed Washington, there's a real demonstration. They want to burn down our embassy. So this somebody from Washington said, why don't we show a movie about one of your leaders who is really, benevolent leader and who is really favorable to this country. So this diplomat felt that, if I show this movie, they're going to burn my embassy down. So what he did, he had to listen to what Washington instruction was. So he showed the movie on a holy day. The day was a holy day, so nobody would come and see the movie. So what he did was that he was successful not to disturb the local population to show that movie, but at the same time, his government was happy that they showed the movie. So this is what was being meant by emotional intelligence. So McClellan was a professor in Harvard. He was asked by the president like Eisenhower, Kennedy and all, how do I choose diplomats? So McClellan analyzed these findings and find out that what action this diplomat did was he had emotional intelligence. So that was in the 80s, in McClellan paper. There's a paper called McClellan paper. He had the list of qualities how people have emotion. So then Dr. Salloway, I think the spelling is wrong, Salloway is the dean of Yale School. So in 1990 he described what is emotional intelligence? Ability to monitor one's own and other feeling and emotion, to describe among them and to use this information to guide one's thinking and action. That means you understand your own emotion, you understand others' emotion, and use this information, how to handle their emotion, how to express their emotion. Next slide. Then you might have seen this book. This was a bestseller in 1995. Dan Goleman. Dan Goleman came up with the qualities. You need these qualities, or you need this training to develop emotional intelligence. What Peter Salovey described. So this is now all the about 500 corporations, or many corporations are using this training to train their leaders, because they say that 100% of the successful leaders have all these qualities. So they started training people, see that to succeed in life, you need these qualities. What is the first quality? Self-awareness. Then when you understand your own emotion, what's happening? Am I angry? Am I upset? Is it jealousy? Is it real? You'll be able to look at your mind, what your thoughts are coming. Okay? Self-regulation. Then you are able to, can I handle this? I'll show you how to handle the emotions. So that handling the emotions is called self-regulation. Then how do you create motivation to people? A lot of people are not interested. As you know, the studies show that in America, only 30% of people like the job they are doing. Only 10 to 20% love the job. Other people, they just can't stand the job. So they are very stressed out. So how do we motivate people? By teaching them emotional intelligence. Empathy. See, this empathy was not much used in the business sense in America. Suddenly it came. Empathy when you understand what the other person is feeling. You can have empathy run out when you take care of a lot of sick patients and you're empathizing with them, and you are a caregiver, an older person, a senior citizen, parents and all, you're caregiving. And you're always looking at how the person is suffering. You're suffering with them. You get empathy burnout. But to treat that, you need to have compassion. You can never get out burnout from compassion. Compassion means that you're looking at the other person. I understand what you're suffering. I wish you well. Okay? See, I wish you recover. So that's the compassion. There's difference between empathy and compassion. Actually, my next lecture in my Arya Samaj is on that topic. What science is about empathy and compassion. Because different changes in the brain. Empathy makes the brain change different than compassion. Then you put together leadership skill, where the compassion comes to have leadership skills. Next slide. What is the science behind this? See, you have a place in the brain, midbrain, called amygdala. You have a lower brain, midbrain, upper brain. Lower brain is the brain that called reptilian brain, whether you respond to fight, fright, or flight. You quickly react to it. You have a situation, you're driving a car and somebody hit you. You have to react. Okay? But many other situations, you don't need to react. You have no time. You take a deep breath and see what is right or wrong. There your prefrontal cortex guides you what to do the next thing. So when your amygdala is so much hyperactivated that you get so angry and people do things. Many of the leaders, they get very angry and they start saying wrong things, and then they have to change it because their amygdala was hijacked. Dan Goleman used the term amygdala hijack, and they teach in children in school when the children start fighting each other, hitting each other. They said, oh, your amygdala is being hijacked, and you're not able to control your emotions. we need to strengthen our prefrontal cortex. And meditation will help strengthen prefrontal cortex. Next. Emotionally intelligence focus on person's success from materialistic point of view. See what I just told you, science showed that without emotional intelligence, you cannot become a good leader. If you become a good leader, you had a very high points in your college exam and you got a great job. If you don't have emotional intelligence, you're going to lose that job within 6 months or a year. It happened with so many CEOs in America that they analyzed those CEOs. What went wrong? They didn't have emotional intelligence. An emotionally intelligent person becomes a successful leader, becomes adept in handling the relationship, etc. Next slide. The Vedic text is a more holistic approach. They see the mind as an instrument which has the potential to lead a person to eternal happiness or to perpetual suffering. So when we learn about emotional intelligence from Gita, we teach not only to do well, but also this life and next life. Next slide. For the Vedic sages, life and death complement each other, and the one loses meaning without the other. For them, life on the earth is a preparation for life after death. So that's why our teaching is a lot more complete than what we teach in the business. Next slide. So here in Bhagavad Gita, I say that thinking of sense object, a person develops attachment to them. From attachment springs desire. From unfulfilled desire, anger grows. Next slide. From the anger arises the delusion. From delusion, loss of memory, and from loss of memory comes loss of discernment, and loss of discernment, person perishes. See, what I want to tell you about that, you saw the loss of memory. I'll show you some scientific evidence that when you get really angry and you suppress the anger, science has found out that you lose the memory. They have done functional MRI of the brain, and they have done studies show that when you get, you repress your anger. You're angry with somebody and you don't express it. You keep it inside. That anger causes loss and causes high blood pressure. So that's why you need to handle the emotions. Next slide. Arjuna, Arjuna is told by Lord Krishna says that your right is to work only never to the fruits thereof. Do not be cause of the fruits of the action, nor let your attachment towards inaction. Then what exactly, when you teach meditation, mindfulness, they say that, you are not expected that I'm going to get this benefit from meditation. Your duty is to meditate. Results will come only when you do it. Next slide. A well-poised person, forsaking the fruit of action, attains the peace born of steadfastness. Unbalanced person, led by desire, is bound by being attached to the fruit of action. Next slide. From that attention, proliferate, cascade, and creation of meaning come from the secondary emotions, happiness, sadness, anger, irritation, and so on. These are the secondary emotions that we think of as emotion, but they are only the tip of the iceberg. That's what Patanjali said. Next slide. These emotions, they cascade makes the emotion, then loops back and shift our sense to the meaning, self, and modify what we pay attention to endlessly. This is the scientific approximation of sanskara and vasana. See, all these emotion, how you handle it, it expressing sanskara, and also in vasana, which is carried on even to the next life. Next. One of the things that emotions shape is sense of self. That means that our ego. You have to understand yourself, the ego. So emotion also give rise to the meaning, shift attention, and generate secondary emotion. You get the ahamkara. Ahamkara leads to asamita. You are identifying with your ego. Next slide. In yoga psychology, it says chittavritti. The yoga psychology emotion correspondent closely related to Patanjali concept of chittavritti, whirlpools of thought, feeling, sensation, action that seek to know and participate in Prakriti, the material law. Next slide. There are afflictive and non-afflictive emotion from the standpoint of liberation. Afflictive emotion entangle us in the Prakriti, and non-afflictive healing emotion point us towards liberation. This is a very important thing. If you look at this Patanjali Yoga, it tells you that how to deal with the situation by Nirodha. That means that kindness, compassion, joy, and then acceptance. This is the same teaching. Patanjali Yoga Sutra has it. In Buddhism, this is called the Brahma Viharas. It's exactly the same thing, you know. I don't know which came first, but they are identical. They are called Brahma Vihara in what the Patanjali taught. Next slide. You know, science describes the same world. We'll actually go on the next slide. I want to go into the science one. So when you have, you know, emotional awareness, you understand emotions, then you're able to understand what is your strength and what is your weakness. So that's why it's so important to understand emotion. Then you get self-confidence. There's many studies show that if you're confident in yourself, you succeed in life. Confidence is different than arrogance. That's why this can be practiced by mindfulness meditation. Next slide. What is self-regulation? How do you regulate emotion? And to regulate emotion, you have to know how to handle your triggers. Trigger means that what bothers you quickly, you know. Somebody says something, oh, he said that before, and before you know it, you're already angry. So we have to be able to handle that in emotional regulation. Next slide. That means that instead of compulsion, you have to change to choice. Compulsion means that you do it without really thinking, and you do it carelessly. Instead, emotional regulation teaches us to do what is the right thing to do. Next slide. See, emotional regulation, the process of managing your internal state, impulses, resources for the purpose of performing optimally. Next slide. See, if you look at the brain, your lower brain, you notice the emotion, the red, that's where your amygdala is, you know, midbrain, where all the emotions are. You have a threat, your midbrain is activated. Then yourself, and which is the upper brain, and your language, you're able to think carefully, reason out, and then you're able to control it. That's what science shows that. Next slide. And next slide, I'll go over to the science side. Okay, what does science teach now? Studies show that suppose you get really angry, you're really upset, this person really insults you. What do? First stop, without reacting, stop. Then you breathe. You know, when you breathe, suddenly you're slowing down your reactive process. Then notice what's happening. What is notice? When you practice mindfulness, you notice that your body is telling you something that you are either very upset, because either you have a dryness of throat, or you know, your chest discomfort, something like you notice what is happening in your body. You notice that, oh, I'm really angry inside. Then suddenly you reflect. Maybe this person, what he said, doesn't really mean. Maybe I should look at this person's point of view. And then you respond. And so when you look back, go back one slide. See, this is what science shows. Patanjali said the same thing. See that? Patanjali said it's slightly different. He said that you recognize the thoughts and emotions and acceptance of these, inquiry, which is arising in the mind, and non-identification of it. See, it's very similar. What Patanjali said and what now science is, that is taken from the Emotional Intelligence book. It's exactly the same thing. Next slide, one more slide. Okay. So now, this is the research done. This is the research done by these two people. One is in Stanford and one is in Columbia. They show that when you have these problems, when people are really upset, look, pay attention, reframing it. Instead of suppressing or expressing, you reframe it. Look at carefully what is the right thing, and then accept it. That's the end of my last slide, right? Thank you very much. Sorry, I've taken a little extra time.
Thanks, Dr. Gandhi, for a great presentation. This could go longer. Rajwallati already here. Vishnu Arya ji, they can come and summarize all the discussions from the adult's perspective. Thank you.
Shoji, come here. I can't do it alone. I am only rolling a bit. It's a difficult task to summarize everybody when the end of the last speaker, not just one or two speakers. And I took down some notes from yesterday, so I don't have today's notes. I thought I don't listen to Arya, but he denying it, he also. We'll speak. Actually, Gandhi.
Balaji, there is a request that if anybody wants any question for Dr. Gandhi, then please, you have 5 minutes. Okay.
Any questions for Dr. Gandhi?
Yeah, go ahead, Sudhir.
Dr. Sudhir,
Can you make sure the question is not too hard? He's my brother-in-law, so
No, this was a great talk. I enjoyed it. I think you're very practical, what one can do. And the great part of mindfulness is it's got no religious association. That's why it's been so successful in this country. I think the only comment I was going to make, and I want to hear what you think of, the beauty of a yoga, the way we teach it in Vedic Dharma is that it not only teaches you calming your mind as mindfulness does, it actually takes you a step beyond that, which is anand or bliss with that, which is what they're dissociated. And for the Western audience, I always look at how can we attach the bliss part or inner happiness part without even putting religious, with it. We cannot dissociate in our own Vedic Dharma religion with it because Paramatma is what gives you anand. We always say Satchit, Anand, Satchit, and Prakriti, or being being only attracted to Prakriti. You are getting only, distraction. So it is definitely bringing you towards the calmness side, but how to get Anand side. I'll hear you come.
This is a question that I could answer, This is
That's all.
okay. Shut it off.
I think one of the phone has to be shut off, then it will work. Yeah. Maybe one phone at a time.
My answer is actually indirect because in the study, actually I was talking to the youth group about the happiness. So science reported that there was the happiest person in the world. His name is Matthew Ricard. Okay, what is this? Who is this person? He had a PhD in molecular biology from Pasteur Institute. Then he spent next 40 years in meditation in a Tibetan monk. When they study the brain in Wisconsin, they find out that he had the highest rise of the gamma waves in the brain, and that his left prefrontal cortex was much more active than anybody else. And then scientifically they find out that higher activation of the left prefrontal cortex is consistent with the happiness. Okay, so I cannot answer. There's actually a study going on in UCLA by Dan Siegel, who is studying the brain, trying to identify the location of enlightenment. I don't know whether that answers the question or not. He has some preliminary findings in the medial cortex. Okay, medial cortex, some area where people are in a position of bliss, or ananda, where it shows up in the brain. So very soon, in the next few years, you're going to read some papers about brain changes in enlightenment. Whether it's same thing with Ananda, I have no way to compare. Okay, that's a description. It came out more from the Buddhist perspective because neuroscience in America are using Buddhism more because we had a chance. We had all the Swamis came to teach the TM and all the yoga movement, but we did not sell enough into the academic thing. And Buddhists were much more smarter. With the Dalai Lama's help, they sold it to the neuroscientists. So all the neuroscientists are doing research on the Buddhist side.
Dr. Om Sharma.
Mindfulness is a current thing in vogue. In 2012, there were 450 scientific papers written on mindfulness. We have discussed, this is no question, just a comment. We discussed yesterday a book by Mr. Han. He is
Yeah,
from
Thich Nhat Hanh, we wrote a lot of books on that.
lot of books, the positive thinking, happiness under the banyan tree. And what he says is, when to have anger, don't fight. Don't try to suppress anger. And as you said, don't try to suppress the anger. What you do is, as you said, stop, take deep breathing, let anger come to your belly button. It is just like a trunk of a tree. When there is a storm, all the branches they are moving, they shattered, the small branches fall, but the trunk stays. You think what you do is bring it to your neighbor, take a deep breathing, few deep breaths, and think with your brain as to what is good in life. But he tells another very good thing is, they say mindful meditation. They say walking meditation. So what he is saying is,
I don't mean to interrupt you, but can you let the other person speak also? Yeah. That's right, yeah.
I think it's a great topic and very contemporary, and I congratulate you that you have come up with such a good presentation. It used to be emotional quotient, what we are now saying emotional intelligence.
That's right.
And my, another comment is that if you see, there has been a study actually, that if people meditate or do yoga, and their level of auspiciousness increases, and empathy and compassion increases, and that has been directly related to the serotonin level. There is a documentary, 1 hour documentary, Serotonin Rising, and that typically,
oxytocin, GABA, a lot of
typically
studies,
that reflects the
Yeah,
same.
that's right.
So it's a scientific evidence right there.
Thank you.
Oh, there's a question.
One after.
Very wonderful presentation.
Thank you.
And my comment that as you have quoted Gita and Patanjali, and if you will give the reference wherefrom you have taken, which sutra is giving this information, that you have just taken the name of Patanjali, but if you will give the reference, that it will give more impact. And just you can add the next step of self-realization. In this presentation, we are focusing about the emotional intelligence and calmness. And in the same way, if we go further self-realization, then through this presentation, we can make people aware of the existence of soul, conscious energy. And in the same way, further, we can make people aware about the superconscious energy, we say God. So if we will add these two conscious entities, then according to the Vedic views, we can pass on our Vedic concept of Trinity too. Thank you very much for giving this present.
Thank you. Actually, I studied the Western tradition. Now I'm bringing the teaching of Gita and Patanjali into the tradition. So that's why I need a lot of help. I was telling him that most probably I have to go and get some help and training from him when I teach, because the Western audience is what I studied. So I'm trying to bring into our own temples and our own community, which has already been there in Gita and Patanjali Yoga Sutra, but I'm not a scholar on that. That's why I really am glad that you're commenting on that, because that's what I have to develop in the next few years, because I'm training with this place to teach emotional intelligence. I'm going through the leadership training, but then I want to apply this to our own traditions. Thank you very much. Thank you very much.
I think it was a very interesting talk. The management of thought is one of the most important points in life. What I wanted to point out, recently there was a lecture in Natural History Museum. The subject was pain, pleasure, pain, poison, and pleasure. And I think this is what is going on, that everybody gets a pain, whether it's psychological or physical. So we right away go to the poison, which are the medicines. That's what the psychiatrists use. And then we go in the seek of pleasure. So what I think, what we have to insist, that instead of taking those poisons, we change our thought process with the process what you mentioned, always is yoga. The only thing is that I think, yes, I agree with it, whether melatonin or oxytocin or DHA or PEA, all these things, level increases with these drugs and with our thought process management at the same level. That's what makes it.
I think your point is very good. A lot of studies show that many of the things people use for depression, when you practice mindfulness, those levels increase as the drug reduces. It can, replace. In England, if you have a depression or anxiety, before you go on medication, you have to practice meditation. They have a program to teach mindfulness so that it can reduce the usage of drugs in England. It will come in America, but it will be a few more years. Thank you, Dave.